Hello, and welcome to the first joint seminar in a series called Inspiring Conversations. This is the first of a series hosted here at the Royal College of Nursing headquarters in partnership with NHS England. My name is Mary. I'm a student at the University of Southampton studying adult and child nursing, and I sit on the student committee at the RCN. I'm joined today by Duncan. We've had many questions submitted by students, and thank you to everyone who's submitted those. But Duncan, I thought we'd kind of start off with just introducing a little bit about who you are and sort of what your role is.
Yeah, of course. And look, thank you for hosting tonight. I think this is really important, actually, that we do these things jointly together. And thank you for taking the time to do this tonight. So I'm Duncan. I'm the Chief Nursing Officer for England, which essentially means I'm the most senior government advisor on nursing and midwifery matters, and I've got a dual role across both the Department of Health and Social Care and also across into NHS England. So I'm also an executive at NHS England, where I've got a range of responsibilities for a number of different areas. So, for example, lead on things such as children and young people, or the work we're doing around women's health. Or maternity and neonatal care. We look after things like infection prevention control, safeguarding, and all the work we do around the profession and working with colleagues such as those at the Royal College of Nursing, but work on all of the kind of professional issues for our 680,000 or so nurses and midwives in England.
Wow, that's impressive. And you have a very wide sort of role now in the role you kind of currently sit in, but I was wondering if you could tell us a little bit about sort of your journey into nursing, specifically as well around your sort of student experiences, and if there's anything that stands out in that journey to leading you to where you are now.
Yeah, definitely. Well, look, I love being a nurse. I wanted to be a nurse from the age of 15.
Oh, wow.
And I love it to this day. It's just the most amazing profession and the opportunities that it gives you. So when I was 15, I was a very shy child, and my mum, to this day, cannot believe I can even come into a room like this and have a conversation with somebody, or go into a room full of people and talk to them. It's given me the confidence. Actually, nursing has given me a confidence throughout my career. But I started wanted to be a nurse at 15. I did some work experience at Sussex County Hospital when I was 16, which kind of cemented my desire to become a nurse. And I went to Swansea University when I was 18 to do my nurse training. So that was 30 years ago this month, actually. I started my nurse training, and it was great. I think one of the things I reflect on about my time as a student nurse was the way in which the nurses on the wards, and when I was on placement, really looked after you and looked out for you, which I think is really important. It's one of those really important things that you should do for looking after students and looking after for people that you work with. And then I've had a range of different roles throughout my career. So when I finished my training in Swansea, I left and went to Bath, where I started my career in medicine, did respiratory medicine, then I did neurology, and then came to the bright lights of London, and was a charge nurse in acute admissions at UCLH, and I did various different roles at University College London hospitals. Worked my way to be a matron, looking after kind of infectious diseases and the then actually inpatient HIV unit and the hospital for tropical diseases, and then did various roles in kind of emergency services and worked my way up to be a deputy chief nurse at UCLH. And then subsequent to that, I've been the chief nurse in 2 trusts and was regional chief nurse in the southeast of England during the pandemic. And then became Deputy Chief Nursing Officer, and then about July last year I became the Chief Nursing Officer for England. Yeah.
Wow. It sounds like your career's really kind of expanded over the time that you've been a nurse, and I think that's what's really exciting about nursing, is where it can kind of take you. And that kind of leads on to our first question that was submitted by students, was around what you think is being done to attract more people into nursing. Because as we know, we need nurses, we'll always need nurses. So what is currently being done to try and attract people into those roles?
Yeah, definitely. Look, and I think, as I said, I love being a nurse and I want more people to be able to join the profession. So I think one of the things that we are doing is currently we are developing a nursing and midwifery strategy for England, which is one of the commitments that was in the government's 10-year health plan, which is a really important commitment to develop this strategy. And one of the strands of work that we're doing is really focusing on how are we going to attract more people into our profession going forward, particularly around kind of how do we reach out to young people, but also people that might be thinking about a change in career. And I think it's really important to do that, partly because actually there's going to be a whole load of people that AI will change jobs and actually will remove some industries. So actually, this is a great opportunity to attract more people into our profession. So we're doing some work at the moment looking at, we've been doing some analysis of what young people think about the nursing profession and what we can do to attract them. Where's the kind of critical point of attracting them to the profession? But I think also my challenge to everybody that's a nurse or a midwife or a student nurse or a midwife is our role in that as well. So actually recognising that, yes, these jobs are tough, but I think also at the same time, how do we talk about what's great about them, what great opportunities there are to work in any part of the country, any part of the world, actually. And in so many different settings, you can change those. So I think we've got to, my challenge to everyone is really to talk more positively about the profession and the opportunities.
Yeah, 100%. I think nursing's a career that we don't celebrate enough. We love our jobs, but we don't talk about it enough. And I think that's a really nice kind of plan to move forwards as well.
What attracted you to become a nurse?
I think I really underestimated nursing as a role when I was at college and things. And then as I started looking into it, I was just amazed at what it could be. I'm based in Southampton, so like cruise ship nursing is something that I come across a lot. And it's not something I considered beforehand. I always considered that almost Florence Nightingale picture of a bedside nurse that kind of walks the wards. And that is a role I absolutely love. But it's the absolute breadth in what it can be, from prisons to cruise ships to GP surgeries to district nursing to care homes to A&E and ICU. And I think COVID was a really good time that we saw that. We saw how important nurses are to the fundamental functioning of the world when things go really wrong. And I think I love that. Yes. Whenever I meet people and I talk about nursing, I'm like, oh, it's great. Yeah. I've been training for 3 years, coming into my 4th, and I'm like, oh, I wouldn't change it for anything else now. I love it.
Absolutely.
But I agree, I don't think we talk about that enough.
Yeah. And we've got to break down some of those stereotypes and those images that still exist of what nursing is. And, you know, as you've described, nurses work in so many settings. You know, I'm also really keen, and I recognise, you know, look, I'm the first man to do this job in England, and I think there's a responsibility around how do we attract more men to the profession, for example, because we've still got kind of about a 90-10 split, and it hasn't really changed, but we're not reaching parts of our population that might want to think about nursing as a career. So we've got to really try and break down many of those kind of stereotypes that there are.
100%. Looking at kind of breaking down challenges within the profession, a lot of people have been interested and would love to know what information you could provide around planned initiatives to support employment opportunities for newly registered nurses, midwives and nursing associates in the coming year, because we know that's been a massive problem. So we'd love to hear a little bit about sort of what the plans are from your end of things.
Yeah, definitely. And look, this is one of those, I recognise actually that this is a worry for students who are going to qualify in the next year and even beyond that. And certainly I, having trained to be a nurse over 3 years, wouldn't have wanted to not be in a position where I could get a job after that. So it's really important that we help support people into jobs, which is why, you know, you'll have seen this year one of the commitments that the government gave was around the graduate guarantee to make sure that we enabled students that were qualifying this year to get jobs in the NHS or in social care. And I think there's something about making sure that we are communicating and making people aware about the whole range of job opportunities there are for nurses in this country. Yes, the NHS, but there's also some great opportunities in social care as a newly qualified nurse, the independent sector, the military, charitable sectors. And it's been great to work with colleagues at the RCN, including members of the student committee, who have really helped give voice to students and how they're feeling and their experience about this at the moment. But what else can we do, and what else can we do to support? So one of the things, for example, this over the next year we'll be doing is making it easier for you to find jobs on NHS jobs that are for newly qualified nurses, because I know that's kind of trying to go through all of that, for example, is quite a difficult thing. But I think also we need to recognise it's going to be a much more challenging and competitive market. And so actually working with some of our higher education institutes around how do we prepare students better for interviews and that kind of competitive market. But I would say to everybody, just think about the opportunities, and often, you know, one of the challenges I have in my role is we've got to get my colleagues across all of the trust to also think about you don't have to just work in a hospital as your first place upon qualifying. And there is still sometimes, you know, again, breaking down barriers. We've got to kind of break down some of the barriers where people say, oh, you can't work in the community, for example, when you first qualify. You absolutely can.
Yeah, I think that transparency around the roles that are available is something that's really interesting, especially where a huge amount of our placements are obviously focused in those more acute areas. It's quite easy to think that that's the first step into a career when there is that kind of wide variety available to people. I was also going to ask around that sort of clinical experience, what's being done around the consistency of placement experiences that's being offered to students currently, where they have experiences in different trusts or different environments, especially around access to practice educators and within their clinical placements?
Yeah, definitely. And look, and I recognise that there's variation between the experience of students depending on which organisation they go to, even between in an organisation between which wards they go to, and you know, and that's something I've experienced being a chief nurse in a trust as well. So I think one of the key things, and I would encourage students to fill out the NET survey and make sure you kind of give your views on this, because this is really important. We're really using this with trusts to put voice to the experience and to be able to highlight areas where the experience is good, somewhere the experience is not so good. So actually that really kind of helps put some visibility on that. And, you know, we carry that through into things like the staff survey into the NHS every year. So I would encourage everybody to do that, because it's really important so that we can put some visibility on the experience of students, and where do we therefore need to put some more energy or resource or time to be able to improve that experience. But I think there's other things that, you know, certainly through the nursing strategy that we'll be doing around how do we broaden out some of the placements that we've got and those placement opportunities, which I think is really important to give students a really rich experience of all the places that you can work as a nurse. We were talking a little bit earlier about how do we give people more experience in community settings or adult social care, for example. And I think that also then, that diversification of placements also takes some of the kind of pressure off clinical areas, so that you get that really good attentive experience as a student. Yeah. But you might well have some thoughts and ideas, and I know people listening to this will have thoughts and ideas, and I think it's really important through, you know, the student committee that you tell us what those things are that would make it better.
Yeah, 100%. And I think linking into that around sort of ensuring that placements are adequately supportive is what support mechanisms are currently in place for students who are experiencing those challenging placements, and what sort of your advice to students that are maybe having some slightly more difficult experiences in their placements? Yeah,
well, I mean, the first thing I'd say is I think ask for help. It's okay to ask for help, and, you know, not just as a student, throughout your career. Actually, when I was a student nurse in Swansea, I I came out as gay, and that was a really difficult time for me. And I can remember to this day, being stood on the orthopaedic ward at Morriston Hospital and just feeling completely overwhelmed because my family just found out. It's a really difficult time for me. And that kind of being able to separate sometimes your personal life from your work life is not easy. And I went and saw my personal tutor, and I have to say, she just put me back together. She really looked after me. Spent time with me and followed up and just made sure and checked in on me. And I have to say, to this day, it's a real lesson in how important it is in these jobs to be kind to each other. And so I would just say to anybody that's struggling, please reach out. Please reach out either to your colleague on that's on the ward. The university have got lots of support in place. There's mental health support. We've got support that you can access through the NHS for staff. There's lots out there, and I know the RCN have got lots of support for students as well. So look out for it. Don't be afraid to ask for help. I've had to ask for help during my entire career. I found the pandemic a very hard time, and got some support from a psychologist after that, because I found it really tough to process what had happened. So it's okay to ask for it, but please do, because there are people that want to help. And look, if you don't get a positive response from somebody, go to somebody else. I think we are a caring profession. So.
Yeah. 100%. And as you mentioned it, and as we're in this building, I think it's always worth mentioning how much support is available to RCM members through the services that we provide. Something that I don't think students are always aware of, and this is often true in trust as well. All the support that is available to staff nurses is also available to students. We've got our hub that can access support on wellbeing, counselling, financial aid, all of that sort of stuff as well, where I think being a student is such a stressful period of time, and you have so many things to try and juggle that actually accessing that support is very natural. And I don't know many people that have got through a nursing degree without at one point putting their hand up and saying, actually, I need a hand with something at this point.
Yeah, and we've got to normalise this actually in the profession, because this, you're absolutely right. You've got the toughness of going through your training and your education and juggling life as well, and that's going to be something that's going to be there for your entire career. So actually getting into that kind of habit of knowing when you need some extra support and help, I think is really, really positive.
Oh, 100%. I think it's something we need to be better at practicing.
Yeah.
On that sort of vein of support is around what support is currently available for our international nursing students, especially as we're having more international recruitment within our degrees currently. Sort of what support's available for those students?
Well, look, the same support is available, and I think one of the things actually I led during the pandemic was all the international nurse recruitment for the NHS, and one of the things I recognise is that for international students or for international staff that are joining us, you've got to adjust not only to a new university or training or a new hospital, you've got to adjust to moving country and navigating all the complexities of that. So again, I would say to any international students that are struggling, ask for help, ask for support. But I think also to other students and colleagues, think about just be mindful about actually there's a change of cultural environment that you're moving into, and actually just been recognising that support and reaching out to those students and colleagues is really important as well.
Yeah, 100%. Moving on a little bit from the support side of things, but in a similar vein around clinical placements, is a question about how concerns about unpaid placements are currently being addressed. Sorry, I'll let you.
Oh, that's okay.
So yeah,
I thought the question was going to be a bit longer. So.
No, there's a second part, but
Yeah.
we'll come back to it. But how concerns around unpaid placements are being addressed?
Yeah. Well, look, I think the reality of this is that placements are not paid. Because of the nature of how we train students and, obviously having access to some of the maintenance grants, etc. But I think we also therefore need to just recognise, and one of the important things is about how flexible we are and how we support students who might be needing to manage and juggle life and perhaps employment, etc., or part-time work. So we've got to kind of think about how do we support people through that. But, at the moment, placements are not clearly not paid.
Yeah.
But one of the things I think is really important, therefore, is how we also, and one of the kind of commitments in the 10-year plan and some of the work that we're doing around the nursing strategy is how do we make it easier once you've qualified and you're ready to qualify to transition into work as quickly as possible. And I think that's really important as well, so that we don't have a gap, of students waiting once they've qualified.
Definitely. And then this is a much wider question, but around concerns generally around pay. This has obviously been quite a big topic recently that's come up several times in the news, but generally about what you're aware of around the issues around nursing pay.
Yeah. Well, look, pay is a matter for the government to decide, and that's why it's important that, nurses have their voices heard through organisations such as the Royal College of Nursing. And actually, that's why it's really good, such as yourself, you get involved in some of the work with giving voice to colleagues and to fellow students. So, recognise that it's really important, therefore, that we have those opportunities for people to feed back and to feed back into government and work with the Royal College of Nursing.
Yeah, 100%. And there's massive work being done currently within the college around pay. And as I'm sure you're aware, those conversations are still ongoing.
Yeah.
Moving on a little bit from that sort of student experience, is talking about what advice, as you were saying, you started your career sort of 30 years ago, what advice you would give to nurses who are currently starting new jobs or are coming into the end of their programmes and starting those preceptorships. What sort of advice you'd give to those nurses at the beginning of their careers?
Yeah, I wish Duncan 30 years ago could advise Duncan, when I started my career. Well, look, I think one of the things that I would reflect on is do things that make you feel a bit uncomfortable, because I think that's where you get, those challenging opportunities. Although you might be a bit fearful of them, actually they help your growth. Yeah. So, throughout my career, and to this day, I do things that make me feel a bit uncomfortable, partly because I think it's actually how do you enable growth in yourself. So when opportunities come up like that, just don't dismiss them straight away. Yeah. I think also the other thing, look, there's lots of opportunities for nurses, not just in the NHS but outside. Don't be afraid to move around. Yeah. And if you don't like a place you're working or don't like that, try something different. There's lots of opportunities to be able to do that. I think we need to make it easier for people to move around, and that's one of the things we'll be looking at through the nursing midwifery strategy. But yeah, don't be afraid to do that. And then I would also say, work on yourself. So one of my biggest reflections and I've learned this throughout kind of my 30 years, is the thing that you can control in life is yourself. And so, it's okay to make sure you're developing yourself, make sure you take advantage of the professional development that's available, and seek out those opportunities, because improving yourself and improving your impact and how you work, I think, is one of the really important things throughout your career. Actually, I had the opportunity to do some leadership development the other day, which was great because it gave me a bit of headspace, a bit of time out, enabled me to connect with leaders from outside of healthcare and understand actually many similar pressures as leaders and solutions. So continue throughout your career to focus on those things. And the last thing I'd say is the importance of kindness. So lift your colleagues up, do things to support other people. I've had some amazing role models that have really looked out for me during my career, which I'm truly grateful. I wouldn't be in this job or wouldn't have been in other jobs had they not done that. So look out for other colleagues, lift them up, and be kind to yourself and be kind to other people.
Yeah, I mean, that's just a good methodology for life, isn't it?
It's true. But it doesn't always happen, though. That's the thing. So,
doesn't.
Yeah.
Definitely something that people need to prioritise, I think.
What have you learned during your kind of last 4 years of being a student?
It's hard to put it into a short answer. I think nursing's changed who I am significantly. Yeah. I think I'm more empathetic. I have more of an understanding that everyone has a story, both from my patients and my colleagues. You meet somebody and you may have initial perspectives, and 99% of the time they don't turn out to be true. They are people are very complex, and that's one of the reasons I love nursing. I love the complexity of it. I think I've also learned a lot about my own resilience and what I can handle and what I need help for. And that's definitely a skill I'm definitely still learning, and I think I will still be learning throughout my career, is that sort of self-awareness and self-reflection. But they're skills I'm really grateful to have, because aside from my professional life, they benefit who I am in my personal life as well. And I think that's a really strong ability, to be able to look at a situation and go, can I handle this, or am I going to need someone to give me a hand? And I love that bit of nursing, of always trying to consider that. And in that as well, that emotional ability to take a breath and stop. I was very much someone, and probably am still a little bit, of someone that just jumps into things. Whereas now I'm like, okay, stop, take a breath, and then we can start whatever that is. So it's definitely calmed me as a person.
Which is a great skill to have, actually. That's it's something I've had to learn, and probably I'm sure some of my team will say still need to sometimes. But just taking a breath and standing back, I think, is really important.
But it's really interesting to hear what people's advice is, and I love talking to people that are at different stages of their career, because they all have such different perspectives based on the journey that they've been on, and I think that's really interesting and valuable, especially as I come into starting my newly qualified jobs in the next year or so. So thank you so much for sharing that. I was wondering if you could tell us a little bit about what information you have around preceptorships for newly qualified nurses, because obviously that's such a crucial part in a nurse's journey, as that very first year where you're kind of finding your feet as a professional. So any information you could give us on that would be amazing.
Yeah, definitely. And preceptorship has changed quite a lot from what it was 30 years ago to now. But I think the thing that resonates with me, and I still remember my first day as a newly qualified nurse, I was terrified. But I had some great people that, again, supported me, looked after me, showed me how things work. And I just, again, the importance of asking for help, I think, is a statement I will always make, because I think that's when people get into a bit of difficulty, is when they don't do that. I think we've got some work to do on preceptorship, because it is variable between different places. And I know, kind of talking to many students, many newly qualified nurses, that people shop around actually a little bit, because they know that there's different support in different places. So I think there's a bit more we need to do to reduce some of that variation that's in place. But I think one of the things, when you are exploring what opportunities there are for jobs and newly qualified, is to make sure you do explore what is available for people, because that support is really important. And I think don't be afraid to ask during that year and beyond, to have career conversations with people, help get that guidance about where next, what to do, what more to what professional development that's available. There's lots and lots that is available for newly qualified nurses in trusts, and that kind of support. So again, just talk to your mentor, talk to your line manager about what's available.
Yeah. And sort of final question on that perspective of like preceptorships and things, is what guidance from sort of NHS England is there to NHS Trust recruitment of newly qualifieds to ensure that there's equal access for graduates from all universities, ensuring that there's sort of that equity of job availability?
Yeah, well, look, I mean, as I say, we've done work this year on the graduate guarantee and making sure that we've got advice and support out for trusts that are employing people. We've got guidance out actually about preceptorships and preceptorship model, and trying to drive up the standard of preceptorship as well. And we've put that out over the last few years. But we've also got lots of advice and guidance that's available. We've put a lot of resources on the website this year around how you can access jobs, how you can access some of that kind of support in your early career as well. So look out for that, and I know you guys at the RCN have helped support not only creating that, but also making sure people know where that advice is.
And as we've sort of come to the end of our questions from the students from before the event, what I wanted to ask you is around how you see the nursing profession evolving over the next decade. Obviously, that NHS long-term plan's just come out, and that gives us sort of an idea, but especially in the role that nurses will play in addressing new patient healthcare needs. We know that healthcare needs of our population is changing drastically, and how nurses will be involved in addressing those needs.
Yeah, definitely. Well, look, I think, and I'll go back to the nursing midwifery strategy for England that we're developing, because I think it's a great opportunity to not only engage the profession as we've been doing in conversations about what does the future of the profession look like, but also what are our patients and our population going to need from us as professionals. And I think that's a really important starting point, not only now, but, you know, thinking 10, 15 years in the future, how are things, as you say, going to change? And it's been great as part of the process. We've been putting together the strategy. We've had early careers nurses working alongside some of us more experienced ones to chair the groups that are focused on different parts of developing that strategy. And that's great because it's given us a really different perspective, a different generational perspective on the work that we should be doing. So I think one of my reflections would be that we've got a lot of change happening on things like genomics, you know, AI and digital, and how do we respond to that? And I think that is something that people shouldn't fear. It's something that we should absolutely embrace, because I think this is not about reducing the number of nurses that we have, but it is actually about how do we make that working life a little bit easier, and how do we make our patient care that much better. And, you know, you look at some of the kind of ambient voice technology that's available. It means we can have a conversation face to face rather than me typing into a computer screen and trying to have a conversation. That's brilliant, because that kind of changes the nature of conversations. So embracing really kind of our role in tech, digital, our leadership in that is really important. But look, we've also got big global health challenges, and, you know, and I know particularly a lot of motivation from our early careers nurses around our place in global health and thinking about some of the climate change, the climate crisis and how we address that as nurses, but also, you know, recognizing that some of that is meaning that health is changing and we'll need to respond to different kind of health emergencies over the period of time as well. So I think there's a lot in there that we've got to develop. But I think also fundamentally, how do we make working lives of our nurses and midwives much better, thinking about career pathways, how can we make those much clearer, lots of commitment for things such as advanced clinical practice, which I think is a great opportunity for keep senior clinicians with patients longer. So I'm really excited about the kind of next few years, lots to do, but I think, you know, we've had some great engagement on this, and we're still open to ideas and views and thoughts about how we should shape the profession of the future. I'm sure you've got some thoughts and ideas you'd like to share as well.
I think I agree with you. I think technology is such an interesting one, and I think trying to keep up with the technology that's coming in is, even as somebody that's obviously grown up with technology, is quite challenging, seeing how new technologies can be introduced to improve patient care. I'm working in a trust that's had new technology implemented in the last 2 weeks, and it is challenging to get my head around it, but actually I can see how much that will improve patient care, how much easier it will make communication across professionals, and ensuring that I think curriculums match up to those changes as well, and trying to keep contemporary on top of those issues, especially when things, I mean, the pandemic showed us how quickly things can instantaneously change, and keeping us flexible as practitioners, that we don't get stuck in doing things in a certain way, because quite quickly those things can change, either due to technology introduction or things. Let's hope that we don't have another experience like the pandemic, but if it were to occur, that we have the flexibility in our profession to respond to that appropriately.
Yes, definitely.
And with environmental challenges on how that affects the populations that are coming in to see us, and the health issues that they'll be presenting with, and how different that will probably look, and preparing my own practice for that.
Yes.
And feeling confident enough to be able to support those patients appropriately.
Yeah, definitely. And I think also, you know, if you look at some of the kind of technology, I think it will also change some of the power dynamics between patients and us as nurses, because, you know, people much more kind of, you can tell, you know, from your smart device whether you've got, you know, what your blood pressure's doing. So I think that's a real opportunity we've got to engage with. But I also think particularly some of the challenges around public health and our role within that are really important. So if you kind of look at the health of the population is not great in many ways. So how do we really help and support? How do we make every kind of opportunity that where we're engaging with patients or the public to really drive that improvement in health? We were talking before about vaccines, weren't we, and the importance of vaccines. One of the simplest and most effective things that you can do to protect your health. But we've got a challenge around that. We've got a challenge around misinformation on social media. So actually, I would encourage anybody that's listening that hasn't had the flu vaccine, get your flu vaccine. But we've got a job to do to promote those kind of things that actually really make a difference to people's health and lives.
Oh, 100%, yeah. So thank you so much. That was a really interesting insight into the future of the profession. We've also had some questions from people that have been watching live.
Great.
So you're not as prepared.
Okay, here we go.
So the first one we've had through is, how important is my first nursing job for my long-term career? So thinking about whether that first job is how important that is to the career that you end up undertaking.
Yeah, well, look, I would say, yes, your first job is important, but it doesn't define you. Yeah. So again, I would say it's you will get a rich experience wherever you go, and so I don't think you need to worry too much about, I have to work in this area if that's where I want to work long term. You can get great experiences and great skills and opportunities from the whole range of nursing and those roles, whether that be in primary care as your first job or a community service or a hospital. So I think go somewhere that is going to support you, go somewhere that is you're going to get a good experience from, but also don't be defined if you don't like it or you want to try something else, do that, try something else as well.
I think that's the beauty of nursing, isn't it? Is the flexibility of the careers that are available to you.
Yeah.
Now, we've spoken a little bit about first nursing jobs, but someone has also asked what a day in your life looks like now. So as you've come to sort of all the way through your career so far, what does a sort of day look like for you?
Yes.
Not every day at RCN headquarters, unfortunately.
No, unfortunately not, sat by a fireside. Well, I have to say this, the job of the Chief Nursing Officer for England, there isn't a typical day. Because I can go in one day thinking this is what I'm going to do, and events will take over and it will be quite different. But it can be a whole range of different things, which is actually one of the great privileges of this job. So, I will be in various meetings, trying to influence health policy or trying to influence what are we doing around the profession. That means a lot of work with different stakeholders. So, whether that's talking to the Chief Exec of the Nursing Midwifery College Council or the Royal College of Nursing, talking to Nicola, for example, or it can mean as I'm off after this, I'm off to Birmingham after this because I'm speaking at Nursing Live tomorrow, and I'm also staying in Birmingham to be able to do a visit to Birmingham Women's Hospital on Thursday, and that's partly because what I try and do within my role, as well as having to do lots of different things, is actually stay close to what's happening on the front line, how people are feeling. Those visits are a real good opportunity for me to connect with all sorts of nurses, midwives, nurse directors, and understand what's happening in clinical practice. So there is no typical day for me. Sometimes this job is 7 days a week, but it's an absolute privilege to be able to do, because there are so many just amazing nurses and midwives across this country just doing phenomenal work. And so part of my day-to-day job is to try and emphasise that and give voice to the work that's doing, and just how can we make my colleagues' lives a little bit easier so they can do the fantastic things that they do for patients and the population. Yeah,
100%. And I think that sounds incredibly interesting. I am wondering, as you mentioned earlier, that you're the first man to sit in your role. Do you have any reflections on what that experience has been like and the importance of you holding that role?
Well, again, it's a privilege, but I would say I therefore hold a few things really important as part of that. So I really hold the responsibility of leading a profession that is predominantly female. I think is really important, partly to make sure that actually we are really strong on issues which affect women. And actually, as I said before, I've got women's health in my portfolio. So that's again kind of how do we give voice to issues around women's health, but gender inequalities, and actually any kind of inequalities, because we've got a very diverse profession. And so actually really trying to make sure that we address all types of inequalities is really important. And so I'm really mindful of that, but I'm also really mindful of the opportunity as well around kind of how can we attract more men into the profession, because we haven't cracked it. And actually, I think therefore, as I said before, we're missing out on a whole load of people that might want to kind of join the profession and see the wonder that is nursing.
Yeah. Do you have any ideas or thoughts on that, on attracting more men into the profession?
Yeah, I think, look, so some of it is we've got to break down some of the kind of stereotypes which we talked about earlier. But I think we also need to increasingly go into places and talk about nursing to men, to boys, to think about actually where we've got role models to be able to go out and talk about that as well. So just breaking down some of those gender stereotypes that are still there for us as a profession, I think is really important.
Yeah, 100%. We've also had a question through from one of our other members of the Students' Committee. So she's asked, how can education and leadership best equip students to promote inclusion and tackle health inequalities, especially for marginalised groups who may face barriers to engagement, digital access, or who have no fixed abode?
Ask me the question again. There's a lot in there.
So, I'll try and simplify. So, around how our education and leadership can support students in helping to promote inclusion for those patients who struggle to access our services, such as those who have no fixed abode, or who have difficulty accessing like digital services, things like that. So, our more marginalised proportions of the population.
Well, look, and actually I see every single day nurses in clinical settings or in leadership positions really trying to address inequalities, both for patients and populations, but also within our own workforce, because there are inequalities, no doubt, within our profession still that we need to address. So I think one of the kind of fundamental things that I see is actually people working with communities, and trying to work with marginalised communities and address that. And look, there's some fantastic nurses that work in the inclusion space. You know, great examples of nurses that work with homeless communities, that work on addressing inequalities in a number of different ways. So I think one of the important things around education, the way in which we're educating students, and also how we develop in our future leaders, is really to make sure that we are talking about inequalities. We're talking about the approaches that we can take to reduce those inequalities and address them. But I think that one of the great things about our profession is that because we're everywhere, in every setting, you know, 2% of the working age population of this country, we see inequalities, and we're in those communities. So I think doing more to give voice to and prepare people for working with them, with different marginalised groups, I think is really important. So again, you know, my challenge to our educational institutions and to us is to do much more in this space.
Yeah, and engaging within those conversations as well, I think, is really important. This goes back to a question you asked a point you mentioned earlier was around the role of AI in nursing. As we talk about how nursing changes, how you perceive that AI may change nursing roles, or how they can support us to provide that care in a more effective way. So just generally your thoughts on AI and how we work it into our work moving forwards and how it could change things moving forwards as well.
Yeah, definitely. Look, you know, fundamentally, patients will absolutely need nurses, you know, nurses giving physical care, emotional care, you know, that's not going to be replaced by AI, but what it will do, I think, is really help support things such as safety. How do we make sure that some of the kind of algorithms help us spot things that bit quicker and that bit earlier so that we can intervene. Actually, we talked about inequalities, but how can we use data and some of the AI tools to help spot things, and therefore where we can provide more targeted care and release time to be able to provide much more targeted care, I think is really important. So I think there's a great opportunity here. I want to see more nurses leading in this space. We've got some great examples already, but I think this is one where we've got to really embrace it, to champion our role in this. And then I do think, as I said, some of this is about how do we free up time from some of the administrative work that we have to do? How does it improve communication between different parts of the system? And we automate that. So I think there's great opportunities there, but I would encourage everybody to, if you don't know about it, learn about it, but also become leaders in that space as well.
100%. I think it's a really interesting area that's becoming more and more prevalent as every year kind of goes on, I think.
Yeah, and I don't think we've even, I think you said, got a head around what the potential there is. I mean, there's probably stuff that's already there that we don't know about that, is down the track. So I think it is about kind of how do we adjust to that and embrace it.
Yeah. And something you've mentioned a couple of times sort of earlier is around that professional strategy for nursing and midwifery. So I was wondering if you could give us any more information on that, and also when it would be available for students to access.
Yeah, definitely. So as I said, look, this is one of the commitments that was in the 10-year health plan for our professions, which is great because it was a really strong commitment for nursing and midwifery to develop a strategy which will kind of focus on the next 10 to 15 years. And all the kind of areas that we'll be working on, thinking about our role in global health, thinking about the work we need to do to improve the experience of nurses and midwives, and also career pathways, our work in tech, our work in research and education, and all of those kind of areas within the profession. So we will, and this is a strategy not just for nurses in the NHS, it's for nurses everywhere, whether you're in the military or whether you're in the social care or the independent sector, charitable sectors. So for all. And we've done some consultation work over the last couple of months to get people's views and thoughts into that. So really grateful to everybody that's helped shape that. We've done some listening events as well. And so we're just collating all of that at the moment. And in the springtime, we will come out with a strategy for nursing and midwifery for England, which I'm very, very excited about.
That sounds really exciting, and it sounds like it'll be interesting to see sort of what that kind of looks at and how that will kind of move the profession forward as well as we look at that and the NHS long-term plan. It's a really exciting time for nursing, I think.
It is, definitely. And, will reflect, absolutely the 3 shifts of the 10-year health plan, which I don't think I've ever heard anybody disagree with, because, why wouldn't you disagree with more care closer to home and, moving from analogue to digital and supporting, better health for people?
Yeah, 100%. The sort of final question I have is around what sort of opportunities moving forward as we look into the future of nursing do you think there will be for nurses outside of those sort of traditional bedside roles that we've talked about a little bit, about what roles will exist outside of that, especially as we look to that NHS long-term plan and the professional strategy coming out in the spring?
Yeah, definitely. And look, one of the things I'd say, those roles exist now.
Yes.
And we've got much more to do to actually highlight those. I mean, we were talking about prison nursing, weren't we, before the start of this? That's just one example of, one of the settings that nurses work in. But, we've got nurses looking after all ages. We've got nurses looking after in every community. And so I do think kind of one of the opportunities around the 10-year health plan and the nursing midwifery strategy is how do we help people in the professions be exposed much more to community settings, for example, and how do we make sure that kind of as a student you get exposure to those different types of settings. I kind of reflect back to when I did my nurse training. I probably spent no more than 4 weeks, 12 weeks in a community setting, and so probably didn't really see that as something for me when I qualified, and so we've got to do much more to expose people to that. So I think that's an opportunity, I think, to really think about kind of how do we expose people to some of those different settings. But then, as I said, more roles in places such as genomics. I think that's going to be a real kind of growth area for nursing, and one of the commitments in the 10-year health plan is around our role in genomics. Tech, research, there's fantastic examples of nurses working in research, but again, I think that's an area where we can absolutely grow the impact that of us as a profession in research, and the kind of economic value of that, I think, is really important. And then things such as advanced clinical practice, I think, again, is a really good example of opportunities to grow within the profession, but for the benefit of patients, so that patients get the right care much sooner and earlier. So I think lots of opportunities. And there's probably a whole load of things that we haven't even thought about yet.
Yeah.
It's the science and the technology hasn't kind of come there.
Yeah, don't even know it exists, so you can't plan for it.
Yeah.
I think it's really exciting to think about how diverse the future of nursing is, and the future of technology, and all of those really exciting things that, especially as students, I think we look to the future and we're like, oh, it's such a wide future that feels really exciting.
Yes.
Very nervous at the same time, and apprehensive, but it's an exciting time, I think, and one that I think is filled with a lot of opportunity, and hopefully can improve health outcomes for our patients as well.
Absolutely. And one of the things I get struck by, because I get to go and visit universities as well and meet student nurses in this job, which again is a joy, is that gives me real hope for the future, because there's the enthusiasm, the confidence, just the drive for the profession gives me hope for the future as well. So it kind of, I'm sitting here thinking 15 years time, there'll be a whole load of people that are, training now that will be delivering all of these things, and it gives me really real hope.
Yeah, and I think it's about encouraging students to have those aspirations and push forward in those more exciting and future-proofing our services to make them suit our population as they grow and change. And the environment we provide care in is going to grow and change naturally. As I'm sure 15 years ago, healthcare looked very different, and I'm sure in 15 years it will look very different.
Yes. But one thing that's true is that we will always need nurses.
Oh, I mean, we've been around a very long time. You're not getting
We're
rid
not
of
going
us
anywhere.
anytime
We're not going
soon.
anywhere. Yeah.
And I think that's a really nice part of the profession as well, as we're almost a constant in our healthcare services. People know that if you're accessing any form of healthcare, you're probably going to have a nurse somewhere in there. And that's a really nice thing, I think, and it gives that continuity to our patients and their families, that they know that there's someone that has nurse next to their name that can be there for them.
Definitely. And the most trusted profession, which I think is something to be really proud of.
Oh, 100%. And like you were saying earlier, it's one of those areas of nursing that we don't necessarily celebrate enough, is the trust our families and our patients put into us. And that's something I think as a profession we can be really proud of, because that's something that's been earned. It's not been handed over.
It's precious to keep that.
So. Oh, absolutely. And I think the nurses that are working every single day, and the students that are working within those environments alongside our nurses, are working towards maintaining that as well. So, yes, it's a very exciting time, I think. It's been a really interesting conversation, and thank you so much for coming in and kind of contributing your thoughts to those conversations. We've come to the end of the sort of questions that we had. I wondered if you had any closing thoughts, and then at all.
Yeah, well, look, firstly, let me just say a massive thank you to you for spending time with me this evening and interviewing again. Kind of, we had some time beforehand for a chat as well. And, I know the profession is in safe hands with you and with colleagues that I know will be listening. And I think also it's great that you've got involved with the student committee here at the RCN, because I do think that bit about how do you support people, how do you give voice to people, I think is really incredibly important. So, I know there's lots of examples of students and nurses that get involved and get involved in shaping your hospital, get involved in driving improvement in your local community. So, those are things that you should carry with you throughout your career as well. But look, let me just say thank you to everybody that is listening as well, because the contribution that you make from the moment you start as a student nurse to the moment you will finish your career as a nurse or a midwife is enormous, and sometimes it goes unseen, but never underestimate the impact that it has on people, people's lives, on colleagues. It's really important. So thank you for everything you're doing, and again, as I said before, don't be afraid to ask for help and support when you need it, because we all do it at various times.
And thank you for being an advocate for the profession and the conversations that you go into, and ensuring that nursing is in every health policy and conversation around what our health services look like. This is the beginning of a series of webinars where we'll be having conversations with various people. And it's a reminder to anyone listening that those will be accessible. This session's also recorded for those that weren't able to attend in person or want to go back to it. There are many RCM resources for members, which we mentioned slightly earlier, around that support and asking for help if people feel like they need it. There's also, as you mentioned, the National Education Training Survey, which closes on the 2nd of December, but that's a really important opportunity for students to be able to get their voice heard in what nurse training looks like, and that's being used in conversations to plan workforce and how trusts respond to students, and I think that's something that it's really important that students engage with to get their voice heard in the most important of places. And an email will be sent out to anyone watching with sort of questionnaire for any feedback, so that they can let us know if this was helpful.
Yeah.
But yeah, I wanted to say thank you again for coming. It was really lovely to meet you, and these conversations have been really interesting.
Great, thank you.
And thank you to everyone watching.